Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Welcome to the Gastro Girl podcast, your trusted resource for digestive health information and support. I am your host, Jacqueline Gaulin, and today we're diving into an incredibly important topic, metastatic colorectal cancer, with a special focus on young-onset cases. As we've seen a troubling rise in colorectal cancer rates among younger adults, it's critical to explore the unique challenges this population faces. We're honored to have Dr. Kimmie Ng with us to share her invaluable expertise and insights. Dr. Ng is a medical oncologist and an internationally recognized leader in the field of colorectal cancer. She serves as director of the Young-Onset Colorectal Cancer Center at Dana-Farber Cancer Institute and is an associate professor of medicine at Harvard Medical School. Dr. Ng's groundbreaking work focuses on understanding the rising rates of colorectal cancer in younger adults and developing personalized approaches to the treatment and care. We're thrilled to have her here today. This episode is brought to you by Takeda. And as always, friends, don't forget to like, subscribe, share, and write a review for the podcast and the podcast episodes. Thank you so much. Thank you for joining us, Dr. Ng. It's so great to have you on the show today.
Thank you so much. Happy to be here.
Dr. Ng, can you start by explaining what metastatic colorectal cancer is and how it differs from early stages of the disease?
Sure. So colorectal cancer staging is determined by several different factors, including how far through the wall of the colon the tumor has grown, the number of lymph nodes right around the tumor that are involved, and whether or not the cancer has spread to distant organs far away from the colon. And so stage 1 is when it's really confined to just the most superficial layer of the wall of the colon. Stage 2 is when the cancer has grown into or through the muscle layer of the wall of the colon. And stage 3 is when there are lymph nodes right around the colon tumor that are involved with cancer. Stage 4, or metastatic colorectal cancer, is when the cancer has traveled beyond the colon and regional lymph nodes to be involved and affecting organs that are distant from where the primary tumor first started.
Wow. So we've heard about the rising rates of colorectal cancer in younger adults, and this is so alarming. It's been increasing just year by year. What does the data show, and are there specific risk factors that are unique to this age group?
Yeah, so we have been very concerned about the rising rates of colorectal cancer in people under the age of 50. So while overall the incidence of colorectal cancer has been actually declining steadily over the past few decades, largely due to improvements to adherence to screening programs, unfortunately, this benefit and decline has not been seen in young people under the age of 50, where we have seen about a 2% per year rise in both colon and rectal cancer in both men and women since the mid-1990s. And unfortunately, it's gotten so bad that actually colorectal cancer is now the leading cause of cancer-related death in men under the age of 50, and the second leading cause of death in women under the age of 50, trailing only breast cancer in the number of deaths due to cancer. So this is a serious problem, and we really need to start to understand what the underlying reasons are for these rises in young-onset colorectal cancer.
From your work and your research and your care of patients, is there any data that shows any of what could be causing this increased incidence? It's really alarming.
Yes, it is very alarming. And we do have some clues, although the exact cause or combination of causes is still not known and is one of the biggest questions out there for researchers to try to answer. So what we do know is that the increase in colorectal cancer in young people seems to follow what we call a birth cohort effect, where the risk travels by generation. So for example, somebody born in 1990 now has quadruple the risk of developing rectal colorectal cancer and over double the risk of developing colon cancer compared to someone of the same age who was born in 1950. So it really is something that's generational. And when we see this type of pattern of increase, it usually suggests that it's some recent environmental change or environmental exposure that is likely contributing to why the rates are rising. We do know that a lot of young people do get diagnosed with a hereditary syndrome. Probably up to a quarter of young-onset colorectal cancer patients do have a hereditary condition, but that means that the vast majority do not have a family history, and it is likely environmental factors that are underlying why they got this cancer.
Wow. So the $1 million question, and we've had so many stories pop up in the media. It's red meat, it's processed food, it's the water, it's, supplements that we're taking. What can you share with us for patients to be aware of as it relates to what they're eating and consuming?
Great question. And as you may know, colorectal cancer is the cancer that is most strongly linked to diet and lifestyle factors in terms of underlying risk factors. So we do know that colorectal cancer, regardless of what age you're diagnosed at, is associated with obesity. It's associated with a higher intake of a Western pattern diet, which is high in things like red meat. It's associated with lack of physical activity and sedentary behavior, as well as intake of sugar-sweetened beverages and a variety of other risk factors. And when we look at whether those risk factors also contribute to a higher risk of young-onset colorectal cancer, we do indeed find in many studies that there is a link between, for example, obesity and a higher risk of developing colorectal cancer at an age under 50. There's a link between sedentary behavior and a higher risk. But I have to tell you, the patients that I see in my clinic who are young, many of them are perfectly healthy. They're not obese. They follow healthy diets. They're actually often marathon runners. And so there likely is something else in the environment that's explaining why this is happening.
God, when you hear those stories all the time, like this person has the picture of health, they're an amazing athlete, and they have, unfortunately, they are diagnosed with colon cancer in their 30s. It's just horrible. Are there any other studies that indicate what it could be?
Yeah, so this is turning out to be a very challenging problem to study because what we think is happening is that there are environmental exposures, some of which may be diet, lifestyle related, some of which may be pollutants in the air or chemicals that we're ingesting, but they're likely having an effect starting in early childhood, if not infancy, and during adolescence, and likely inducing changes in our DNA or microbiome or immune systems over the decades as we age that likely contribute to a higher risk of developing this cancer in later adulthood. And so to study that is really difficult if we're trying to understand what a person was exposed to early in their life. So a lot of researchers are coming together and trying to put their heads together to figure out how exactly to determine which early life exposures are actually contributing to why people are now getting colorectal cancer so young.
Yeah, I'm glad you brought up the microbiome because I was going to ask about this. Microbiome, for better or for worse, has been a focus of GI and of overall digestive health. With all the attention on the microbiome, with all the products that say they're targeting the microbiome and people taking all of these things that are supposed to, is there any causation between the things that we're doing and also with those antibacterial things that are destroying our natural immune system? Is there anything possible that could be a link to it?
Yeah, so these are great questions. And, I have to admit that the field of research into the microbiome is still in its infancy. There is still so much we don't know about what the microbiome is doing in terms of our risk of multiple chronic diseases, including cancer. But the microbiome is trillions of organisms, mostly that live in our colon. And science has shown that they likely do influence the risk of how a cancer develops in the colon. We also know that the foods we eat, our weight and how active we are all affect the composition of the organisms in our microbiome. And so because we do see this link between environmental factors and colorectal cancer risk, we do wonder whether those environmental factors are acting through the microbiome by shaping the microbiome in a certain way that may increase the risk of developing colorectal cancer at a young age. But currently, we don't yet know what are really the good bacteria, what are the bad bacteria that have led to an increased risk of colorectal cancer. So until we know that, we typically don't recommend things like probiotics for patients who are diagnosed with this disease.
Yeah, no, this is such a fascinating area, and I'm trying to play Nancy Drew of GI and trying to figure out and get to the root of it. But it is so, when you start thinking about all of the factors, it's very interesting, but it's challenging.
Very challenging. And, you asked about antibiotics earlier. Certainly the use of antibiotics has increased kind of parallel along with this rise in young onset colorectal cancer. And we do know what antibiotics do to the microbiome. So there is a lot of interest in studying whether increasing antibiotic use may be contributing to why there is an increased rate of young onset colorectal cancer. But I have to say that the data are pretty conflicting out there. So right now, there's no conclusive evidence, at least, that is the responsible culprit.
Okay, Dr. Ng, I'm not going to get the answer that I'm looking for, but that's okay. No, this is great. And the reality is there are people that are coming down and being diagnosed with young onset colorectal cancer. So what we want to do now is bring attention to the symptoms that people should look out for. They may not realize that that could be an indication of this, and how it's diagnosed. So what symptoms should young adults and healthcare providers be particularly vigilant about?
So the interesting thing about young onset colorectal cancer, and we don't have an explanation for this either, is that most of them occur in the left side of the colon. So this is the descending colon or the sigmoid colon, or they occur in the rectum, much more so than in an older patient diagnosed with colorectal cancer. So because of this left-sided or rectal location of the tumor, the most common symptom that young patients present with is often seeing blood in their stool. So certainly if a young person sees that and it persists, they should seek medical attention for further workup. The second symptom most commonly seen in young patients who get diagnosed with colorectal cancer is abdominal pain, bloating, or a sense of pelvic pressure. But other signs to look out for also include a change in your bowel habits, a change in the caliber of the stool with much thinner, pencil-thin stools, unintentional weight loss, as well as fatigue or shortness of breath with exertion that may indicate that there is anemia going on. So those are typically the most common ways that patients present.
Now, Dr. Ng, this is challenging too for patients because we've had other experts on talking about other conditions like IBS or constipation or chronic idiopathic constipation, and some of the symptoms seem similar. Even women's issues. We may have, things going on in our reproductive system that may have the same type of pressure and uncomfortability. What is your guidance for our listeners on how to navigate this and not to ignore it?
Yes, I think you hit the nail on the head, which is just how non-specific these symptoms are.
Yeah.
And if you look at the absolute numbers in a young, otherwise healthy person, yes, blood in the stool is most likely due to hemorrhoids. And a lot of these symptoms are probably more likely due to something like irritable bowel syndrome. But I think that if a symptom persists over a month or 2 months or starts to get progressively worse, that is the time to really start bringing this up with your primary care doctor and really making sure that they are aware that this is not normal, it's progressing, it hasn't gone away, and that further workup should be considered.
So Dr. Ng, if you can, do you have a story or an anecdote that you can share about a patient who may have ignored the early warning signs and what that did to the trajectory of the disease?
Yes. I mean, I don't have a specific story because this is all too common, unfortunately, among the many young patients that I see in my clinic. But there was a survey of about 1,000 young onset colorectal cancer patients that was conducted by the Colorectal Cancer Alliance that showed that 2/3 waited more than 6 months before seeking medical attention for their symptoms. And I do think that this is due to a lack of awareness of what symptoms are and that colorectal cancer can happen happen in a young and otherwise healthy person. And when these young people did eventually seek medical attention for these symptoms, they had to see 2 or more different healthcare providers before being correctly diagnosed with colorectal cancer. And that indicates a similar lack of awareness among frontline providers seeing these patients that, again, colorectal cancer can happen in a young person. And so in this survey study of 1,000 patients, over 70% ended up diagnosed with stage 3 or stage 4 metastatic colorectal cancer, partly because of these long delays in diagnosis. So any effort that we can participate in to help increase awareness of what these symptoms are and the awareness of the rising trends of young onset colorectal cancer will help in terms of early detection of this disease.
That was a fantastic answer. I mean, that was so enlightening. And if we can expand on that, for patients, a lot of the patients, a lot of our listeners are proactive. They want to have information that they can then use and share decision-making with their providers. So what is your advice for them that could prevent this long delay? Like when is it okay and how do they push? Do you know what I mean? How to be their own patient advocate to get the answers that they need sooner so they're not bounced from test to test, or they're delayed a test, they're delayed a colonoscopy, for instance.
Yeah, I think, with the increasing media attention around young onset cancers in general, I am hopeful that there now is more awareness among healthcare providers as well as the general public that cancer, unfortunately, now is being diagnosed in many young people. I also hope that the new guidelines for colorectal cancer screening, which changed from starting at age 50 and is now starting at age 45, will also alert especially primary care physicians that, yes, there is this rising pattern of young onset cancer, which prompted these change in the age at which to begin screening. I also think it's just really important to be sure that somebody has a good primary care doctor and that they have a good trusting relationship and that there's open communication with both sides listening both ways to what symptoms are happening. And that, I do think that more and more physicians are paying closer attention to these symptoms and are acting quicker to work them up, especially if they've been persistent or worsening.
Oh, thank you for that. Now, in terms of diagnosis, what we are very familiar with is colonoscopy. Maybe patients need to, maybe we can help them understand the important role of colonoscopy. But there's also, we see advertisements for other tests that don't involve a colonoscopy. Can you explain a little bit about how colorectal cancer is diagnosed and why one test may be better than the other and at different stages? Like if someone's having blood in their stool or significant risk factors, would they have a colonoscopy or would they take like one of those tests that you can get from and mailed to you?
This is a great question and is often so confusing to people.
Yes.
So, definitely if somebody is having a symptom, including blood in the stool or abdominal pain or unintentional weight loss or another red flag symptom that's really concerning, colonoscopy is absolutely the best way to diagnose colorectal cancer. And often patients get CT scans of the abdomen and pelvis as well to work up some of these symptoms that they may be having. But for purely screening purposes, the best screening test is the one that gets done. And so that's why the U.S. Preventive Services Task Force includes a menu of different options for patients to consider for their colorectal cancer screening. Now, it's important to distinguish screening from if you're having a symptom, right? Screening is for somebody at average risk who is not having any symptoms. And for those people starting at age 45, they should consider either a colonoscopy, which we often say is the gold standard test because it can catch things at the polyp stage and remove it and completely prevent cancer, in addition to detecting cancer at an earlier stage. Or if, because there are real barriers to doing a colonoscopy, they can consider an at-home stool-based test that is really easy to do and is very good at picking up cancers at an earlier stage. Again, the best screening test is the one that gets done, and it's just most important to do one of them. And recently, there has been a blood test that has been approved as well, again, mainly for earlier detection of asymptomatic colorectal cancer that adds to the toolbox that we have for patients to get screened.
No, thank you for that. Now, unfortunately, if someone's diagnosed with colorectal cancer, what are the current treatment options and how effective are they?
Yeah, so this will vary depending on whether it's colon or rectal cancer and what stage it presents at. But for localized colon cancer, usually the first option is surgery to remove the primary tumor. And then, depending on whether they have lymph nodes involved or not, sometimes a course of chemotherapy after the surgery is recommended to increase the chance of survival and decrease the risk of recurrence. For rectal cancer that's localized, the treatment is a little bit more complex and usually involves perhaps chemotherapy, sometimes radiation, prior to getting surgery for the tumor. And now there are even ways where if patients respond really well to chemotherapy and radiation and their tumor completely disappears, sometimes surgery can even be skipped or omitted and patients watched really closely. And so surgery may not be needed. So that field is evolving and more data will be coming soon on the best way to treat localized rectal cancer. But for someone, unfortunately, with stage 4 or metastatic colorectal cancer, because it is a disseminated systemic disease at that point with cancer cells traveling through the lymphatics and through the bloodstream, the mainstay of treatment is chemotherapy.
And do young adults with the CRC face any unique challenges, or how does the treatment differ between the age groups, if at all?
Yeah, so I recently participated in the first international consensus guidelines group on how to treat and manage our young patients with colorectal cancer. And for the most part, the medical treatment of young patients is very similar to that of older patients with this cancer. The difference is we do know that younger patients are in general healthier than older patients. They're more robust and they often are able to tolerate more doses of chemotherapy and often have less side effects to chemotherapy. So studies have shown that younger patients do get more aggressive treatment with combination regimens of chemotherapy, and they do more often undergo surgery and radiation compared to an older patient. But unfortunately, all that additional treatment has not actually led to corresponding gains in survival. And for the most part, the survival of a young patient is pretty similar to that of an older patient, despite them having this additional treatment. And studies have also shown that the very youngest patients under the age of 35 may have a worse survival compared to those in their 40s or older. So there's a lot of work to be done to better understand what is different about a cancer that happens in a younger person versus an older person. But there are 2 distinct recommendations that should apply to every young onset patient. And that is that everyone should undergo germline genetic testing to look for a hereditary syndrome. So although I said most patients do not have a hereditary syndrome, it is more common to find a hereditary condition if you're diagnosed younger. So that's why genetic testing is recommended for every young patient. And then the second very important thing is that patients should be counseled about fertility preservation prior to starting treatment. And this is especially important for patients with rectal cancer, for example, who may need to undergo radiation, which can affect their fertility options down the road. So because of this unique stage of life that young patients are diagnosed in, that is a really important consideration for our young patients.
Yeah, and I was going to ask you about some of the challenges, the medical and emotional hurdles, and you kind of mentioned, are there any other additional ones with younger patients? I mean, those are significant ones.
Yes. So we do know that even though it's difficult to get a cancer diagnosis, no matter what age you are, there are different challenges with a patient who is diagnosed under the age of 50. So in that same survey study of 1,000 young patients with colorectal cancer, 80% report experiencing anxiety or depression or having mental health issues. And the vast majority do need to seek medical support or attention for those mental health conditions. There are really high levels of psychosocial distress among this young population. We also know that the vast majority have children under the age of 18 at the time that they're diagnosed, or they're planning to start or continuing to expand their families at the time that this happens. There's also financial toxicity associated with this. There's career disruptions, education disruptions, relationship difficulties. And so all of these things do need special attention paid to, which is one of the things that our Young-Onset Colorectal Cancer Center at Dana-Farber has set out to do, to provide these unique supportive services for this very unique group of patients.
Wow. Yeah, we're going to get into that in the next question because I have a whole question about the support for patients and families, and this is really important. It's all important. This is really eye-opening. So in terms of prevention, and again, it probably ties into what you said earlier, are there specific steps that young people can take to lower their risk of colorectal cancer, especially metastatic colorectal cancer?
Yeah, so as I said before, screening is probably the most important and effective way to prevent colorectal cancer. So everybody at average risk should start screening at age 45. And if they have risk factors like inflammatory bowel disease or a family history, screening should probably start even earlier than age 45. Which brings me to the next important point, which is to know your family history. It is really important that families talk to each other about whether there is a history of colorectal cancer in family members and whether there has been a diagnosis of an advanced polyp in a family member at a young age, because those things actually may indicate that somebody needs to start screening a little bit earlier, which can certainly help with prevention and earlier detection. And then finally, diet and lifestyle, although I just said that, those are not the only explanations for why the risk is increasing in young people, but they're still really important, especially starting at a young age. So promoting healthy behaviors like not smoking, not drinking alcohol, trying to minimize red meat in the diet, maintaining a normal body weight, and getting a lot of exercise in starting from young ages is extremely important to protect against the risk of colorectal cancer.
Oh, thank you for that. And now this is so important. The support for patients and families. I know you've done amazing things at Dana-Farber. Could you share what other resources, including the ones at your organization, are available for support systems for patients and families navigating this?
Absolutely. And, we started our Young-Onset Colorectal Cancer Center back in March 2019. But before we did so, we conducted focus groups of young patients as well as their caregivers to really better understand what the needs and experiences of young patients are to help inform the supportive services that we would want to include in a center dedicated to this patient population. And we published this study recently in JCO Oncology Practice, where we identified 4 primary themes. One is the need for navigation, because if you think about it, these young people were healthy prior to their diagnosis and really often do not have familiarity with the medical healthcare system at all. 2 is the need for psychosocial support, given that they're juggling multiple different roles at this stage of their life. 3 is that there are disruptions to many of their roles and the need for kind of peer-to-peer support as well. And then 4 is the interest in research, participating in research, and also in genetic testing to hopefully help prevent this in future generations. And so with the results of that study, we have incorporated a dedicated patient navigator in our program that meets with every young patient at their very first visit. We have dedicated social workers who have particular expertise in young patients going through cancer, who can do one-to-one counseling as well as hold support groups for our young patients with colorectal cancer. And we have incorporated reflex genetic testing appointments for every young patient who comes to our center as well, just to make sure that that very important piece is not missed. And as part of our center, we've also started a new study for researching the underlying causes of this rise in young onset colorectal cancer called the Beyond CRC Project, for which every patient is approached for consent to participate right at their first visit as well.
Oh, wow. That's amazing that you've done all that. That's great. And then in a few short years, too, you've really broadened your support network for young onset patients.
Yes, and I want to emphasize that actually a lot of the support groups that we offer, as well as the educational programs, are all offered virtually. And so a patient doesn't actually have to be a patient at Dana-Farber to have access to these resources. I know that a young onset colorectal cancer center is not available at most places across the country or around the world, but because these are virtual, they are open to any young patient who is needing support.
And I just want to briefly talk about the role of clinical trials and how they play a vital role in advancing treatment. Can you explain why they're so important and how patients can find and access these opportunities?
Absolutely. So if you think about it, every treatment that we have today for colorectal cancer was once a drug tested in a clinical trial. So the only way to discover novel treatments and improve survival for patients with colorectal cancer is through clinical trials. So it is so important that there are clinical trials available to as many patients as possible, regardless of background, regardless of resources. So there are many different types of clinical trials. Phase 1 trials are usually the earliest type of clinical trial where they're testing really new drugs, often for the very first time in patients. And the goal is mainly to characterize the side effect profile of these new drugs, as well as determine the best dose to bring forward. And often these phase 1 trials also look for a signal of whether it may be effective or not in shrinking down these colorectal cancers. Phase 2 trials are usually larger and the next step in development of a drug, where they're really hoping to solidify that efficacy signal that may have been seen in the phase 1 trial. And then phase 3 trials are really large and often international, and often involve randomly being assigned to either the current standard of care treatment or the standard of care plus the novel drug, for example. And the goal of these large phase 3 trials is often to get the data needed to get FDA approval so that these new drugs can become part of the standard of care. The best way to find out about what clinical trials are available and appropriate for a particular patient in a particular situation is probably for the patient to talk to their oncologist about what is out there and what is recommended. But other resources include the Cancer Center's website. They often have a listing of the trials available at the center. Clinicaltrials.gov is another website that lists all the clinical trials that are being conducted. But I do hear that it's often cumbersome for patients to navigate that. So again, I still think that talking to your oncologist is often the first place to go if you want to learn more about clinical trials.
No, that's really helpful because we get patients asking about that all the time. And one more question before we get to the key takeaways, Dr. Ng. How can caregivers and family members provide meaningful support to their loved ones during treatment?
That is such a good question. And we have been learning more and more that caregivers are an under-recognized group in regards to their needs because they have some of the most difficult jobs, right, in this whole cancer experience. But, I think every caregiver and the patient has their own individualized way of coping with a serious diagnosis like this. So usually recommending open lines of communication and just being honest with each other. And, for caregivers, just to be present are probably the most important things. I also think that as we do with our Young-Onset Colorectal Cancer Center, there is not a stigma around needing psychosocial support or social work support as patients navigate this diagnosis. And so we are trying to normalize that by, automatic referrals to social work, because more often than not, there is a need for that type of support between patients and their caregivers. And we also have special caregiver support groups as well. Again, they're virtual also, so open to any caregiver that is helping to care for a young onset colorectal cancer patient. And we have some curriculum-based educational programs as well, specifically for caregivers. We're also starting to do a study that better understands the needs of caregivers and what they go through as they watch their loved one go through this diagnosis. And so hopefully in the next few years, we'll have a lot more information about how to help caregivers.
No, that's so important because I've witnessed a colleague go through this with his wife that she passed away, but he was really struggling. And it's like, take care of the caregiver. The caregiver needs to be taken care of in order to provide the best care for their loved one.
Absolutely.
And that's often hard because there's a lot of guilt, the time constraints, and it's tough.
Yeah. And especially for a young patient, someone in their 30s or 40s, they often then have to assume most of the household responsibilities and then the childcare responsibilities. They probably still have to continue working for insurance and all the meanwhile trying to be there for the patient as well. It is incredibly challenging.
Yeah, well, this has been an amazing conversation. I could talk about this all afternoon, but I know you're busy and you have lives to save, Dr. Ng, but what are the most important points you'd like patients and families to remember about metastatic colorectal cancer and young onset cases?
Yeah, I think, just the awareness that young onset colorectal cancer is rising and is now one of the leading causes of cancer related death in people under the age of 50 is so important to educating people to be aware of symptoms. Also, looking out for symptoms like blood in the stool, abdominal pain, unintentional weight loss is also really important. And trying to normalize some of the stigma associated with these symptoms so that people feel comfortable talking about it and bringing it up to their doctors is also really important. And then lastly, I would say, get screened. It is so important to follow screening guidelines. And if you're average risk, starting at age 45 is so critically important and can be potentially life-saving.
Yes, it can. Thank you so much, Dr. Ng, for sharing your expertise and your generous, heartfelt insights into this critical topic. Listeners, don't forget to subscribe to the Gastro Girl podcast, leave us a review, and share this episode with anyone who might benefit from this information. Thank you so much.
Thank you for having me.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.